morning, everyone. I hope you had some coffee and cookies and you feel recharged for the next very interesting session, which is called the Legal Grey, Discovering Loopholes in the National Laws for Drug Checking Services. My name is Maria Sketre. I'm from Eurasian Harm Reduction Association. Unfortunately, my colleague Igor, who had to facilitate the session, had a family emergency and had to leave, so I will try to fill in his shoes. So maybe first let's review the session plan. We have the 4 presentations. Here are our distinguished speakers, and I believe they prepared very interesting talks for us. So I actually suggest to listen to all the speakers. We will try to limit the presentation to 10 minutes. And so please write down the questions that you should have for any of the speakers, and then we will do the questions and answers session at the end. Yeah, because I want to allow to hear what people have to say, and then I want to allow the questions from the floor, and then I want us to be ready to go to lunch break on time. So if everyone is okay with that, let's start. So I think that the topic is very interesting, and the name of the Legally Grey is actually describes very well the environment and the environment that the drug checking has to operate, and I think we will hear more about that from the countries. We organized the pre-conference for law enforcement representatives on December 1st here in Warsaw, and Neil Woods from LEAP organization was also telling that in UK they had a case where to a certain music festival, the police for the temporary time, for the very restrict location, they decriminalized drug use and introduced the drug checking service in the music festival, which was really like for me, because as he told, actually this was not only the opportunity for the person to know what he is about to consume, but for the most of them it was also the first time that they encountered the specialist from the harm reduction service who could actually give advice about the drug consumption and the risks that it entails. So I think that we will hear more wonderful stories like that. So without any further delay, let's ask Linas Tamošaitis from the Young Wave in Lithuania to present of how the drug checking was done in my native country, actually. So.
1, 2, 1, 2. Let's see. Okay. So in the course of this conference, I've already heard a couple of speakers flat out say, oh no, drug checking is illegal. Well, not in my country. At least it doesn't specifically say so. And, you know, spoilers, I don't have the secret on how to not get arrested. We've been pretty good at not getting arrested so far, but that doesn't mean, next week something doesn't happen. So this presentation is more going to be a guide of why we function the way we do and what is the broader context in which we function. Obviously, this might not work if you are in a different country. It has different context. But if you want to do legally grey services, your job is to be aware of the broader context you exist in not just what it says, in the letter of the law. Because the letter of the law in most countries says possession is illegal in some form, and you can just look at that one line and say, okay, stop. But in reality, we live in a different world, and laws are, supported by judges and prosecutors, etc., and, laws are viewed in a broader context, not just by the letter in which they're written in. So who are we? We're an NGO called Young Wave. We've been active for 7 years now. We're peer-led, we're youth-focused, and we basically do on-site and off-site harm reduction services, consultations, sci-help, and as of maybe 4 or 5 years ago, drug checking. So we are, or in the beginning, we were known for our festival presence, so we were one of the first groups to actually go to festivals, to perform on-site sort of PsyHelp and harm reduction consultations, and we still do that if things still allow us to in terms of human resources and global pandemics and whatever else is happening. We also do in-office drug checking, so you can write to us on Facebook or Telegram. You can arrange for a meeting at a specific time. You can come by our office, which is in the city center, and get drug checking services. We perform drug checking services with colorimetric testing, so it's a destructive testing method. The drug is actively chemically destroyed once you actually process it, and it is also in the center of the city, in a building that is owned by the municipality. So our testing throughput is quite modest compared to maybe something like Switzerland or other countries that have more government-funded testing. We started doing real testing in 2019, and we averaged around 100 tests. By now, we expect to have at least 200 tests a year. This number has increased. It was low in the beginning, but after the arrival of Telegram and the new wave of synthetic cannabinoids, I could say that there was an increase in media narrative, a lot of fear-mongering from the news, and also an increase in consciousness from the user base, thus leading to a demand for more testing. It also depends on how many events and what kind of events we go to, because if you go to a big event, that means you can do maybe like 50 tests, which is a quarter of the potential yearly throughput. So events matter a lot. So we're going to go through, what context should you be aware of if you are trying to operate in a legally gray area. The spoiler is, if someone wants to make you a target, you will always be a target. Your goal is to make yourself an inconvenient target. So, someone really, really has to put in the effort to actually go after you. So the legal context in Lithuania, there are 3 laws which are relevant to our work. 1, drug possession is illegal, so it's criminal. Any kind of drug possession is criminal. Advertising drugs is illegal, but it's not criminal, it's an administrative fine. And drug-related research needs a permit. So if you're a university and you're doing Schedule 1, 2, 3 drug-related research, you have to get a specific permit and you need to be audited by the drug department. However, even though things are criminal, and you could, on the letter of the law, it says, if you are possessing small amounts of cannabis, which can be, even 0.2 grams, you can go to jail. But in reality, no one goes to jail just for possession, because that's not how the judges operate. No one is really interested from the judicial base of putting you in jail because you own a small amount of cannabis or any other drug. It can be different based on previous criminal record, etc., etc. There is precedent for these things, and an also interesting context. Lithuania, I think, is one of the few countries that increased the drug penalties. So cannabis possession used to be a civil fine or administrative fine. Now it's a criminal fine. We're one of the unique cases in that sense in the past 50 years, but that's not really a thing to brag about. We've also noticed that police are becoming more hesitant to actually do arrests or prosecute cases for small amounts of possession. And even in the case I know where people have been, raided based on a tip, and the cops were expecting that they brought 4 vans or whatever, that they would find a dealer, and maybe they found only 1 cannabis plant. The prosecutor might not really be interested in picking up that case, or just kind of putting it under the table. There are cases like that happening. So we do see a trend that, also depending on where you are, probably in the country, but law enforcement is less willing to prosecute such cases. Also in the country, there is no precedent for NGO prosecution or harm reduction NGO prosecution, even though harm reduction NGOs have operated in terms of low threshold programs for, probably longer than my adult life. So these are already solid judicial contexts in which to operate. We know that there is no appetite, let's say, to do any kind of prosecution just for possession of small amounts, which is, in our line of work, you only really come into contact with small amounts. And these small amounts are already destroyed in the course of a minute of you touching them. In addition, it's also good to examine, what does the government think of drug checking? So all of these documents are public. They're public documents saying what is the government strategy in terms of harm reduction and what they want to do. And drug checking is officially listed in the governmental strategy as something that is good and desirable, even though that's not something the government does. In addition, we have government bodies who have been participating in drug checking. They were mainly in the form of research projects, but there is precedent for drug checking services that have been offered in festivals by government entities, which is also good. We don't really get any direct support from the government, and we never get directly mentioned, even though the government knows we do drug tests, and they've seen our data, they've seen our numbers, and they were quite positive to it. But there is still a kind of a politic that because we're not an official government entity, they can't really be officially associated with us, probably because they fear some kind of political repercussion. So we can't get any backing from the government directly, but luckily, we have some backing from the city. Because we operate from an office that is subsidized to us by the city municipality, that already gives us a kind of, I don't want to say untouchability, but it makes us definitely a more inconvenient target because, it's something that broader city forces are aware of, and it's something that they permit. And from indirect conversations, I know that, the director of the institution that runs that building, has had conversations with the local police district and says, is this a problem for you? They're like, whatever. And every time that I've had contact with police during debates and whatever, sometimes they're not even aware that we exist, and when they find out, they don't really seem to care that much. So, it's a good sign, I would say. The other thing is that, I'm not necessarily going to walk into a police office and say, hi guys, I'm doing drug checking, do you want to collab? That might be a bit too excessive because you might still step on some toes and make yourself an obvious target. But out of 7 years of operation, we have never had any negative dealings with police somehow. The only dealings that we have had were not because someone came to us for drug possession, but they came for us for advertising drugs, which we really don't do. But that's kind of a political motivation because there was a major media narrative and someone started to link our site on Facebook, and then, the Facebook army starts reporting you to the police. The police look at these reports, and then they go to the drug department and say, can you look into this? This is random. This is not our jurisdiction. So then, we got called out by the drug department, and then it's a kind of conversation where they're not really interested to prosecute you, but they reached a critical number of complaints where you have to sit in a meeting and basically have this theater where it's like, yes, I will change some things. You promise? Yes, I will change some things. Okay, we have done something, you are going to do something. Great, this is on record, let's move on. So, it is an inconvenience, but in reality, this is the environment we operate in. It seems no one is really willing to deal with us, or no one wants to. Maybe sometimes for political gain, we are a kind of scapegoat of like, oh, these are the people that are participating in drug use, but in reality, that has never really manifested. And over the course of 7 years, we have a pretty reliable record of stakeholders. We've talked in schools, we have good feedback from schools and parents. We have talked to judges and, literally the people who wrote the books on criminal law. It was quite funny because I went to a criminology conference in Lithuania and asked of like, maybe this is the problem. Maybe these are the people that are contributing to the, horrible criminal environment. And they were talking about maybe punishment is bad and we shouldn't punish people for crime. And I was like, what? This is definitely not the place. But, I asked judges of like, what would happen if someone came to you and, complained of, these people are possessing substances for testing. Basically, all the judges told me this is not why the law is written. It is completely not in the spirit of the law, and it should not be prosecuted on that case. Obviously, if the judges were there may be more liberal judges, so I cannot guarantee that all, opinions would be the same. But if you ask around the experts, I have never seen anyone who would analyze this hypothetical and say, oh yeah, this is for sure prosecutable and this is an easy case. Because it has no precedent and because we're basically operating a service where we chemically destroy drugs, it would be quite difficult for a prosecutor to actually frame it in a way that it would be an open and shut case, therefore making you a very inconvenient target. I quite like this hypothetical, that I'm operating what is in principle a drug destruction service. That I take drugs, I put chemicals on them, and then they're gone. And I wonder if, you know, if someone was literally doing a drug incineration service where you would toss drugs in a fire, would the police ever report that case and say, oh, you know, this person is possessing drugs with the intent of destroying them. This is a very serious offense. Yeah, it's difficult to imagine. Many a night I've tried to imagine what that case would look like if it ever came to it. And I think it's much easier to be prosecuted on, you know, things like taxes, administrative things, you know, so you have to always make sure that you're doing things by the book in terms of that your organization is managed well, that you're not skimping on taxes, et cetera, et cetera. So be aware of how things work. Be aware of your stakeholders, what they think, you know, get indirect opinions. You don't have to necessarily, as I said, go and agitate, you know, the head of police, but, you know, there is an ecosystem. Get a feel for it, see how they react, and if really no one is batting an eye, the question is, you know, why not just do it? The thing of legally gray is that it's not illegal. There is nowhere in the law that says you cannot do DC. But, you know, nothing is, it's not illegal until someone proves it is. So try to make a very, very hard case that it is. And I think that's all that I have to say.
Thank you, Line. You are actually very, very good. Only 3 minutes on top. Perfect. And yes, I liked very much your note that in order to operate in the legally gray, you have to make yourself an inconvenient target. And also, I heard a lot during this conference the phrase, think globally, act locally, and I think your example of premises being subsidized by municipalities is a very good example of that. Thank you. Now, before I invite the next speaker, I would like to have a very, very big applause for the people of Georgia who are fighting for their way of life that they want to live now. Let's do it, let's do it. Thank you, because now we will have Mariam Sharozia from Georgia. Yes, she is from the Dixon Research Center, Alternative Georgia, and she will speak about drug checking via syringe vending machines. Yes.
It's okay. Before the presentation goes, I want to ask you to be supportive because it's my first time to be this kind of audience, to be for an audience. So I'll try my best to introduce you our vending machines as well as the drug checking service. So these syringe vending machines was implemented by the supportive of 5% initiative by France and also our friends from the French government, and now it is supported by the Global Fund and National CDC of Georgia. And during this small project, which was funded by the Eurasian Harm Reduction Center, we added this drug checking service to the vending machines. So these are our vending machines, which were implemented back in 2019. And our team did really great job because they created this really special computer-based software to adapt these standard vending machines. So these vending machines serve the people not only from the general population, also people who had the drug use experience, injecting drug use experience, and it was inserted near the pharmacies. So I'll go in details. This vending machines has a really special feature for the PVIDs. So you can see that the upper shelves, there are some products for the sale. For example, these wet wipes, also male condoms with lubricants, and these lower three shelves are specially for the people who inject drugs, and they are covered with this hepatitis C program. So within this special card, which we call, then we call it Sigma card, beneficiaries who are from the harm reduction centers can have access to those paraplanias and all other consumables which we are distributing. So, before the HRI project, there was these 5 packages which were available for those people, and it was opiates packages, also stimulants packages, male condom with lubricant, and overdose package with these leaflets, with the syringes, and also with the naloxone, and also HIV self-tests. So, during this 6-month project, we added these drug checking tools. First one was fentanyl, and we added specifically this tool because it was really helpful and had a high specificity to analyze the drugs in a sample. And also, there was one organization who served people with the recreational drug use and in the nightlife context, and they had really grateful experience and successful experience using these specific reagents. So, during the project, we also added this brief questionnaire to get some statistics and information about the drug checking results. And there was incorporated these 2 questions: what drug did you test and what was the results? So, also within this project, with the help of other peers, we recruited new beneficiaries. So these peers were the trusted ones, and they had recreational as well as injecting drug use experience. So during this project, we recruited more than 100 beneficiaries, and you can see among them are also women, and with an average age of 32. On the slide, you can see the numbers of transactions and the demographics. So in the last year, more than 66,000 transactions were made by the approximately 600 beneficiaries, and mostly by the men with an average age of 39. And also, on average, one beneficiary took more than 100 consumables from these vending machines. So, as you can see, out of all packages, these 3 main consumables that were withdrawn by the Sigma card holders were male condoms with lubricants, also opiates, and stimulants packages. And I would say that in this year, from July onwards, we added these test kits, and you can see in the end of this year, 600 reagents and fentanyl strips were withdrawn, mostly by the men. So, here is the results from the drug checking. 24 beneficiaries answered our questions on the SWMS LSD screen, and as you can see, in the 68 of samples were tested, and among the samples, 70% of the drugs were contaminated with other substances. And also, it showed that most of the cases, the results of and the expectations of the beneficiaries, what they thought they tested the specific drug, do not always match. So, for example, under the name of buprenorphine was this drug tested, and most of the cases in these samples was not detected any buprenorphine. And in the 13% of cases, there was also detected in drug samples fentanyl. And I want to add you one of the most important information, that 30% of cases, stimulants were adulterated with the opioids. So, okay. To sum up, this intervention worked really well because it was really feasible and also really new approach. And within this project, we attracted hard-to-reach groups of PVIDs, for example, the women and young people. And also, this initiative showed us this successful experience to engage with the peers because they help us to recruit new beneficiaries and to involve these beneficiaries to the services like harm reduction. And I will add that here that we had also small focus groups with these beneficiaries, and they gave us feedback that it was, most of the cases, it was very first time for them to be engaged such services. So that's it. Thank you.
Thank you so much. Yes, I think that this is a very interesting approach and can help to really access people who are harder to get and also maybe who are not from the beginning very keen on making contact. So yeah, this is a good one. Now let's hear from Rafael Sacramento, who works in Kaikion. How do you pronounce it?
Kaikion, yeah.
Kaikion Analytics, which is a harm reduction project based in Spain.
Okay, I must confess I'm not really going to talk about legal gray area, just a brief mention about this, but I hope it's interesting nonetheless. So I'm a lab coordinator at Kaikion. We're a lab in Spain, in Catalonia, and I'm going to describe a little bit about what we do and some of the techniques, analytical techniques that are used and that can be useful for people here who might be wanting to start an analytical service, or that they want to test at home, or they have a small collective and so on. So, I need a, where's the thing? Okay, thank you. So we have our main headquarters where we have our analytical lab, but we also do work in festivals, parties, and so on. And I'll just briefly mention that we have a multi-layered strategy. We try to work in different areas. So first, maybe the main project we have is the International Mail-in Drug Checking Service, where people from all over the world can send samples to us by mail anonymously, and we test them. We try to charge as cheap as possible to make it accessible to people. And we do purity testing. We just don't say what it is, but also how pure it is, and so on. We also do field interventions, so we go to parties, we do drug checking in these festivals, we give information, harm reduction material, and so on. And we are also trying to help organizations by offering training, by offering FTIR libraries, which my colleague Nuria will, excuse me, will talk about this a little bit more later. And we are also in the process of starting a fund to also try to help organizations financially or in different ways. So we have a market monitoring project where we purchase substances online. Usually these novel psychoactive substances or research chemicals or also ethnobotanicals. We purchase them obviously not in the name of our lab, because then people may send the good stuff to us to have their name there. But so we purchase them anonymously, and we test them and we publish these results in our website, so for free for people. So if we detect something dangerous in these substances, we will put a warning. And we also try to have a lot of direct community interaction. So we're in Telegram groups, Reddit, and so on, and darknet forums. So we really think that this is important to have this direct contact with people who use drugs. And we also have a drug policy work that we're doing. So in the line of the table that we're talking about here, in Spain, there is no drug checking license either. So what is there? There is, for example, our lab, we have an analytical chemistry lab license, which is not related to drug checking. And we're lucky that in Spain, there is no, it's not a crime to have small amount of drugs in private spaces. So it's a crime if you I mean, it's a crime if you have big amounts, because then you can have like, they can charge you for a crime against public health. Or if you have small amounts, but you're carrying it in public places, they may fine you. But if you have it in private spaces and small amounts, it's not a crime. So we're dealing with that. But we want to try to push for some sort of clarity that would be nice if drug checking services would have a specific license, but let's see. And we're also trying to help people who have legal problems related to drugs and so on. So we have different works in this area of drug policy. So what about drug checking and strategies and innovations, and what techniques are available, what can you use, and so on. So if you have a small budget, let's say you have under 1,000 euros available, you're a small collective, or you're just a person at home, you have a group of friends, you want to test different substances. So these are the three main techniques that are available. So you have colorimetric reagents, which some people have mentioned here already. And the issue with them is, I mean, they're useful because they can help you see, okay, is there the substance or doesn't seem like there is the substance? But they have some, like, let's say, false positives. So maybe different substances will turn the same color with this reagent. So you maybe think it is what it is, but it's not. Or maybe a reaction is like masked under the color. So for example, if you have MDMA mixed with, let's say, amphetamine, maybe you'll just see in a Marquis reagent it turned black. You don't see the red under it, and you think, oh, it's just MDMA. But you don't realize that there is something else mixed in. So it's useful, but there are some limits, like every technique. The test strips, they are very useful to detect small amounts of potent substances like fentanyls or nitazines, and it's recommended for people to use, especially if you're testing substances like opioids or also maybe benzodiazepines. So they are useful. But of course, they are only going to tell you positive or negative. They're not going to tell you amounts, and they are generic for a class of substances. And there is still some tests to do if they have some false positives, but they're useful. And this is something that is very underutilized, and we definitely recommend, is thin layer chromatography. And it might seem a little bit daunting, like, oh, chromatography, I need to be a chemist to do this, and no, you don't. There are, for example, there's a company here in Poland, protestkits.eu. They sell these kits. So they have very clear instructions. You can get this. It's very useful. Why? Because it can tell you if your sample has a mix of substances. So, for example, if you have a mix of MDMA, amphetamine, and I don't know what else, 3 things, you will see 3 spots in the plate. So you already know, okay, it's something mixed. It's not just one substance. So it can even help giving an idea of concentration, like a semi-quantification. So I highly recommend people who don't have a big budget and want to test drugs, don't just use reagents, but also look into TLC. So what about if you have like a bit bigger budget? Okay, you got a government grant or a private donor, whatever, you have some 10, 30,000 euros. Okay, I want to upgrade my work. So still the other 3 techniques are very useful. We still take thin layer chromatography to festivals, for example, and reagents. But then you have near infrared devices. And why are they useful, or why do we use them? One of the main uses we give to these instruments is in parties, in festivals, to quantify MDMA pills. Because let's say you test with the reagents with a TLC, you see, okay, it's just MDMA, the pill. You say to the user, yes, okay, it's good. And then the user, perfect, I'm going to take the whole pill. But what if the whole pill is 400 milligrams of MDMA? It's a way too high dose. So these near-infrared devices, some of them in the market, they can quantify the MDMA pills immediately. It's non-destructive. It's in a couple of seconds. And you can give a very useful information to the person, and you can say, okay, just take half the pill or whatever it is. So the main disadvantage of this technique is that it doesn't detect minor substances. So if it's mixed with a small amount of something else, you're not going to see. And also, some of them, for example, when we use a near lab device, they have a subscription model. So every year you have to pay like a couple €1,000 to have access to their library. So this is really not nice, but it's an option. You have to see the pros and cons. And the FTIR is very useful because I would say if you just get one instrument, I would say the FTIR, because it helps you identify substances with a quite high certainty. You depend on libraries, but there are many available libraries, and they are very, very useful instruments. They can give you also an idea if there are mixes, if the substance is mixed, not if it's like 1% or less, but if it's maybe 10% or more of a secondary substance mixed in your sample, you can still see with the FTIR. So I would say it's very useful. And okay, this is probably not going to apply to a lot of people, but if you're a large harm reduction organization, you have a very large budget, you can buy a LCGCMS, go for it. Of course, you have to be a chemist or be very well trained. And there's the maintenance and so on. And I just want to briefly mention this because it's a kind of a new thing, is the benchtop NMRs. You used to need like a, a big space in a university to have an NMR. But these days you have these benchtop NMRs, and they're very useful. The main use that I would say is why it's worth looking into it is because you can quantify substances even if you don't have a reference standard of the substance. So you can know how much it is, the purity of the substance, without a reference standard. You just need an internal reference standard, which is some other substance that you can buy for reasonably cheap. Okay, so there's not much time, so I'll just mention that this was just like to give you guys a little taste of, if you want to test substances, of course you have services like ours or others in your countries, but also if you want to test at home, if you're the nerd in your group and you're like, okay, look, I can help my group of friends, look into it, and please reach out to us. We have some information in our website how to test drugs at home. If you want a training of your volunteers and you want some help, also reach out to us. If you have an organization that uses FTIR or is looking into it, let us know, because we have free spectral libraries that we offer to people, and also confirmatory testing. If you only test with reagents and there is a substance that you're not sure, you can send to us and we can confirm it. So that's it. Thank you.
Thank you, Rafael. Yes, I think that for me it was very helpful to see the multi-layer strategy, and also thanks for pointing out that community of people who use drugs is one of the players there. That's very important, and also the update of the techniques is really useful. Thank you so much. So last but not the least, I would like to introduce our last speaker, Mireia Ventura. So Mireia is a PhD in pharmacy and has been the director of the drug checking service at Energy Control ABD since 2007. And moreover, internationally, she's the coordinator of Trans-European Drug Information Network. Sorry. And this STEADY project is a network that encompasses all European drug checking services. So Maria will be sharing also her expertise here, and they are sharing the data with the European Monitoring and Information System linked to EMCDDA. Okay, thank you.
Yes. Okay. So, yes, the idea today was trying to give you a little bit overview of several experiences that we have in TEDdy. TEDdy is this network that at this moment we will finish the year with 29 services from 13 different countries. And the idea with TEDdy is to try to monitor on an European away from these samples that are coming from people who are using drugs. And mainly using the advantage that we have drug checking services is that we know what people want to get. So then we can know perfectly if this substance is adulterated and how is the market depending on the substances. Because drug checking is a service that focuses on public health and harm reduction directly directed to people who are using drugs by analyzing their drugs, their contents, but mainly by returning their results. And here is where we are doing drugs, harm reduction with this drug checking service, because the intention is to help that they reduce the risk and also that they don't feel judged. So then the information needs to be very precise because we are talking about health, but at the same time needs to be deliberate in a way that they don't feel judged. So in this way with Teddy, we are trying to do big efforts in terms of analytical techniques, but also in terms of what it works, what it doesn't work. We have several guidelines. All the guidelines are available in our website, but also we were developing some guidelines 5 years before about analytical techniques and also legal framework. We have a specific part of legal framework that was done by our colleague from Italy that we will show one example. Today I'm showing examples mainly from Italy, Switzerland and Germany, but also we'll mention Finland since we have our colleague here. But in these guidelines, one of the most important things for us was, okay, let's try to identify in legal framework which are the most important things that we need to take under consideration, and then let's try to see how we can overcome it, no? And then it's very important, no, what we are seeing here, that before planning, you need to understand how is the legal framework of your country. Then later, here is the link, and also I will send the presentation. But it's mainly, first you need to understand, no, as Linus was explaining, is real forbidden? Is forbidden in real drug checking service by the law, because sometimes it's not specifically forbidden. And then you have ways to sort it out. And also sometimes it's helping a lot, how is a drug defined by your legislation? Because sometimes if it's a white powder, you don't know if it's a drug until it's analyzed. So some services are working with this exemption that they are receiving only samples that they don't know what they are. So in the beginning, they don't know that these are drugs. But it's a little bit to find a way, because it's very difficult to find official licenses for drug checking services. And also it's not impossible. We have it in Portugal and also in Switzerland. They are working on this direction at this moment. And also in Italy, they also got it for specific regions. But sometimes it's very difficult to begin with an official license. So then you can not need to find out which is the most critical point. No? So for some countries, one of the most critical point is, can you handle or touch your samples? And this was example from Italy. And let me introduce a little bit the case study from Italy. It's a success case study that was beginning very bad. So in the beginning, it was supposed to be illegal, a drug checking service in Italy, but then when they were assessed by lawyers, they discovered that finally it was not illegal, so that they could find the way to do it. And mainly, the problem was to touch the sample. So then they implement a technique, in this case Raman, then later FTIR, but are techniques that you don't need to touch the sample. So then, in this moment, it was possible, and then the way they make it, it was with an European project, this BioNPS project. Oh, wow, we never learned how to tell it. But this was a pilot project linked to university, and this was enough to begin to work. Then the good practices and the good way that they were doing was letting them to establish in 2019 a drug checking service in the Piedmont region. That this was, I have been involved in this field for more than 20 years. I can promise you that 10 years before, this was completely impossible to imagine. So this is a big achievement that they made. And at this moment, in 2024, we have 3 services in the Piedmont region and other 5 at the Italian level. So this was one of the examples. And I was asking, Elisa, and also we have Elisa here. So later I would like also to give the word to my colleagues in the discussion, because I was asking them that they could detect the resistance and also the strategies that they were implementing. So mainly, The first resistance, and one of the most important, was from the workers from these services, because they were scared that they could have problems and then could go to jail. So this was the impact of this war on drugs, no? That drugs is better to not deal with them, and that's it. So one of the most difficult work was to convince these people that there is a way to do it, and finally the objective is good. But the biggest fear was these professionals that they were thinking that they were doing something illegal. So then it's like, this was this lack of interpretation of the law, and then this was a process that they need to help them to understand that what they were doing, it was important. Also, this was coming from these organizations that sometimes it's young people, women, underground, these peer organizations that sometimes don't have the same credibility that can have toxicologists from these big institutions. So also, this was a very good work to help these people also to feel empowered that, we will do this because it's a useful way to overcome this drug-free model, that tries to avoid that people are not using drugs, and that's it. So then the strategies that they were using, it was mainly this data collection and demonstration that drug checking works. Monitoring is something that is helping a lot for the reason that I was telling in the beginning. We have this specific knowledge about how the substances are in terms of adulteration. Wastewater analysis or other kind of strategies cannot give this context of why we are detecting the results. Drug checking services, yes. Also another strategy is to participate in the early warning system. This is very important because the type of market that we are analyzing with drug checking services is very specific. It's a market that is arriving to the final user, and when we are analyzing with scissors or other type of ways of monitoring, we don't have this privilege to go until the end, until the last detail of how drugs are arriving to people. So in this way, we are contributing to these early warning systems in a type of data that not other services are able to provide. Another thing is this dialogue with institutions at local and national level. This is very important to talk, what Linus also was telling, to talk, to explain, to detect all the important persons that can be involved and to explain all the benefits of these strategies. So mainly the key factors for success in Italy was also to have this national agency and toxicological lab. This is very important. When you don't have a lot of resources or when you don't have a legal framework that permits you or help you to operate directly, it's very important to have this collaboration with universities because they have this knowledge and they have this credibility that is very important. So then, with the harm reduction organizations, you can have the contact with people, and with the relationship with laboratories is where you can have this credibility. Sometimes it's difficult that from harm reduction organizations, they perceive this credibility, is what it is. But when we do these collaborations, it's very important. Then also, data collection, this is very important, but also the spread of alerts that I was mentioning, and also a small evidence and impact studies. For example, to demonstrate that 52% of people were not taking the drug in case the result was not expected. This is also very important. And also NPS. At this moment, NPS are a threat, and this is a challenge for us, so we need to be very compromise with the techniques that we are using because at this moment it's very difficult to identify several things, but at the same time it's an advantage because it's a threat and it's perceived as a threat. So people that can monitor NPS are very interesting in this moment. And of course also to be part of a network is helping. So mainly the idea from Italy is that is a bottom-up approach from the bottom, step by step. It's very important to act, to not wait for the perfect solution, but to act scientifically. It's better to do steps slower, but well done. And then as future perspective, now they are trying to develop this drug checking service more and more at local, and also to increase the drug checking stationary in the city of Turin, and also the detection of MPS and opioids. But then also we need to have other things in mind. Also, sometimes we need authorizations for the people who are operating. So what was working in Italy maybe it's not working in another country. Also, how you get the reference standards, and no, are minors allowed to your services, and how you are operating, because even if you are operating, you need to be very careful of how you're operating, because things can be backwards. This was example of Germany. In Germany, in 1995 and 1996, they have this even rave drug checking program, but this was repressively ended by the authorities because they decide, they perceive, or they think, whatever, that they were not working with standard protocols and with the protocols that they should work. And until 2023, there was not more drug checking service in Germany. So once is closed, this is very serious, and it's very difficult to return. So it's very important, all the work that they have been done since 1996, mainly to talk with political parties, decision makers, associations, to try to revert these situations. Mainly the resistance in Germany was from the political and executive branches. So they felt that a dealer service generate a false security for consumers and promotion the consumption. So this is what they need to revert. The drug checking services were promoting the drug use, but mainly the key aspects of their success to return the drug checking services. The scene was the factual information about drug checking, also to present positive project examples, networking, and also use some journalists that could help to advocate for drug checking, and also, again, use lawyers to find the way to legal implement it. And at this moment, what we have is a drug checking service, several ones in Germany, but mainly in the city of Berlin. And also they are linked with the Institute of Forensic Medicine, where they have access to HPLC. And also they are having the perspective to expand counseling and analysis capacities, and also to target services to drug consumption rooms, and also to expand. But, and last but was not, what happens when there is political support? This is what happens. This is Switzerland. When you have all your political support, you can bring your lab inside the club and have all facilities. This picture I love. I know that it's quite old, but I love it because it's like to bring your own lab inside the club. So imagine, no, in the left side you have all the machines, the operator, but also in the right side you have all your warnings and all the information, and a nice place to operate. And this is a story from Switzerland. It's a country that we can see that they are learning from their mistakes. No, in the beginning, they have a lot of problems with drugs. 1995, no, we all remember this plus, no, full of people injecting drugs there. But then they decide to do something, and since no, they had this expert meeting, ecstasy, are monitoring and pill testing appropriate tools for prevention, they decide to put resources, and step by step, they were building a lot of facilities. And also, they were building also that this is a harm reduction as part of the Federal Act on Narcotics and Psychotropic Substances. And at this moment, what we have is that drug checking needs an exceptional license, but with what they are working now is to try that this is not an exemption, and is not the exceptional case, and is regulated by the narcotic law. So in this sense, it's very important to know that implementing drug checking services involve truly studying the law and identifying where they can fit within the existing framework. It's always a place to try to fit them. And it's crucial to connect with as many stakeholders as possible and work collaboratively with a network, but also with universities. This is very important. And it's better to progress gradually, but securely, and sometimes it works to start with a pilot project and then continue moving forward. This is also how we implement many of the services, beginning with these pilot projects. And finally, it's important to identify the value that drug checking services can provide and make it visible. Typically, monitoring and participating in early warning systems are key to demonstrate their value to public health. And here, until here. Thank you for your attention.
Thank you for this overview, and also for the specific services from Italy, Germany, and Switzerland. So would you like your colleagues now to complement to the experiences from these countries?
Yeah, also I have Jani, I don't know if you want to also contribute, because also we have another case from Finland that now they need to stop. So mainly also, you can also explain a little bit the progress. I would love it. Thank you, Janne.
Janne Nahkuri from Finland. We had a 2-year research project where we analyzed only trace amounts in drug paraphernalia like plastic bags and plastic cups. So we were using very sensitive equipment in a National Health and Welfare Institution laboratory. Same instruments are used to analyze wastewater, so it's very sensitive. So we did drug checking this way because handling drugs is prohibited and we couldn't get a license to handle drugs for this purpose. There is an exemption in the law to handle drugs for scientific research, but when we tried to ask for that, they said, no, but this is only for like, not drugs from illegal sources, but from legal sources, like for drugs made for clinical trials and such. So this is the way. We got to do it for 2 years. We got research funding for it, but now we are out of funds and we need to find new funding to continue this work. But we did it 2 years this way, analyzing only trace amounts in drug paraphernalia, and it worked well. Of course, there are a few problems with it. I don't think you can do like quantitative analysis, and there is a little, it's not always sure if people mix their bags when you don't see the drugs, but mostly it works fine.
Okay. Thank you.
I don't know if Dominic or Elisa, do you want to add something? Or if somebody wants to ask.
Yeah, for me it was very interesting to hear the first presentation from Linas, is your name, right, from Lithuania, because our argumentation concerning this question of drug possession was always very similar to yours. So it was kind of a critical discussion whether drug checking is some kind of drug possession for the staff, but you will find no judge that prosecutes this situation because it's just we're taking away the substance and then it's getting destroyed. So it was quite interesting to hear that, and maybe to adapt with the discussion we have now an exceptional permission by the Federal Office of Public Health, which Mireia mentioned, and we want to change it into a regular permission because it's also some kind of political step forward to say that drug checking is a regular thing and not an exceptional thing. And we have now the situation that we are by the law on the same level as sniffing dogs are, which is quite a joke that we made at the internal. So my staff is on the same level that the police dogs. It's the same legal basement in the Swiss narcotic law, so it's also, let's say, a creative way to find some legal basement.
Yeah, well, I have no a lot of things to add with what you, Mireia, said, but just a fact that we were always scared about the police, and also as Young Wave named, what about if police arrive and things like this. At least we also think that perhaps police is not so interested in what we are doing because we are not in touch with big organizations and we are not useful for them. And yeah, in Italy we had the same experience of Lithuania because drug checking was carried out for years and years for underground organization, but no one arrested this underground organization. And then lately, in the last time, we sent a direct email to the prosecutor to assess if actually drug checking was legal or no, because we have a lot of persons that are still thinking in Italy that drug checking is not legal, and also in the Piedmont region, because even though drug checking is inside the law, you have some public director that states, no, drug checking is illegal. While this is not true, so we decided to stop finally all these things, all of these false tells, and we sent a letter directly to the prosecutor, and he said that there is no concern about the illicit things in doing drug checking, because what is punished by the Italian law is the possession or to deal with drugs, but if you want to use the drugs, and in a drug checking service, workers are not using drugs. And so I really hope that this will be the final stone put on these false legends. But I think that beside that the law, we have also to consider the psychological point of view, and also all the impact that the war on drug still have on workers, because mainly what I see nowadays in Italy is that people are scared to deal with the drugs, and also it is not easy for harm reduction in Italy in this moment. And when you go to the psychological point of view, I think it is very, very more difficult than when you deal with the law, because the law is something very technical, the psychology not so much.
Yes, thank you so much. So now we can open the floor for the questions. Okay, we have one right away. Estonia.
I don't remember if it was Küken or Joona Panga who pointed out that there have been no legal problems. Although the picture is gray or hazy, you haven't had any problems with official bodies. Are any of you aware of there actually being in some other jurisdictions such problems, and if so, what happened in court? How were these things settled?
It's working, yes. So as far as I know, no drug checking service has legal problems until now. So all other psych cares or something, yes, when deaths are related. But of course, a big problem is when a death is related. So in this sense, it's very important to take very seriously the results of drug checking services, because of course, if something is related to death, is related with the result of drug checking. This is one of the problems. But for operating until now, drug checking service are not having problems, legal problems, because also they are operating until this public health, these harm reduction strategies, and with police you need to talk before. You need to talk before and to try to make the agreements. No? For example, if we are operating inside a party, they cannot be next to us, because of course, no, then people will not reach us. So it's something, no, to talk with them. And sometimes you are impressed about the need also for policemen about the results of drug checking services, because sometimes, no, they ask us to help them to identify NPS. Sometimes they, last year, not very far away, we detect a policeman in the queue of a drug checking service inside a festival, trying to analyze the samples that they are getting because they didn't get enough tests for them. So then when we got him, like, come on, no, but that they are taking seriously our results, because of course they know that we are the experts analyzing NPS. So it's also this way to collaborate, to understand that your objective is different than their objective, that finally, no, what we are trying to get is to reduce the risk from drugs. So then they are working in one position and we are working in another position. And this is a little bit the way that is working better in our country, to try to recognize the work of everybody, but not interfere. And clearly the police interferes a lot if they are present when we are operating. And until today, this is working quite okay.
Okay, thank you. We have 3 questions for now, 1, 2, and 3, and then you, okay.
Well, Viktor Mravčík from Czech Republic. We have one service in your map. Mireia, it's framed as a scientific project, which is different, I would say, legal framework for operation of the services. I think that, Mireia, you are a bit biased. I mean it in positive terms, because members of your network are those who are operating. You mentioned Germany, which was closed for many years, in Czech Republic as well, yeah, at the end of 90s, at the beginning of the new century. there was a police. It wasn't case. It was warning. It was prosecution of clients of the service. And then it stopped the development of the drug checking services for the next decade, basically. And last year we had in Czech Republic prosecution of clients of the service you have in your map. Simply, there was a festival queue of the clients, and then police searched persons and started, the cases, either administrative or criminal. So I'm so sad, hearing this and always hearing that we have to justify what we do and find the loopholes and bypasses and so on. So we need to break this paradigm of prohibition finally to operate normally, as in normal, non-totalitarian democratic states, I would say. Anyway, thank you very much.
Anyone wants to respond? Or no?
No, that you are totally right. That of course we need to operate. We should operate without any restriction because we know perfectly what we are doing and for what we are doing. But since it's not evidence-based, this is one of the problems, no? But also, I would like to know how evidence-based is this drug on works, or I would like to see the numbers. But yeah, this is another topic.
So, hello, it's Karen from Malta. It's very interesting to see all these developments in Europe, especially the TEDI network. Unfortunately, there are no drug checking services in Malta. People are also afraid to buy reagent test kits, and there are no test strips available, especially when it comes to fentanyl or nitazines. And I'm curious how much of an involvement you are in the EU drug strategy, and how much maybe the availability of these services could be included in the EU strategy, especially maybe very basic, test strips. I'm happy to be joined here by the National Agency from Malta on Prevention and Treatment, but he's not here anymore, which would be a best positioned government agency to reach hard-to-reach populations with these at least strips to prevent the exposure to synthetics. So that is my question. Thank you.
Do you want to ask? No. Okay. Indeed, is in the European drug strategy is state harm reduction and this implementation of services, but the thing is that the countries are doing whatever they want. I mean that even the WHO is also mentioning the need of harm reduction services, but then is every country, but is in the recommendations of the strategy. Yeah, and this was going worse in the last strategy, because in the strategy from 21 to 25, this is much more back. Before, in the one before, but we are going to the right in Europe, this is very clear, and also in the European drugs strategy is also being very clear. With the Civil Society Forum on Drugs, we have been trying to advocate for this and to change it, and it's very difficult. So it's mentioned, but very generally, but not the, so it's mentioned as general strategy, but not the operational work. That is when you can define exactly which are the strategies that are involved in this. So there are two plans, the general one and the operational one, and in the operational one, in the next, in the current strategy that we have, it was missing. This is something that we miss from the last, and that it seems that it's not going better, but this is related more with political change. That, yeah.
Just very short comment on that. Until recently, I was the head of the Monitoring Center for Drugs and Addiction in Czech Republic, which is part of the Office of the Government, coordination body of the drug policy. We were always supporters of the drug checking and harm reduction and so on. Yeah, that's clear. But if you look at the European level, because I was part of the, for example, this RATOX network of now EUDA before EMCDDA. When the TEDI was discussed there among the, I would say, monitoring people and scientific people, there was not consensus on that TEDI should became the part of EUDA activities, EMCDDA activities, because some of us in RATOX network from some countries considered this as undermining the policy of the country, if it was accepted. And it was operational scientific monitoring level, yeah? And at the political level, at HDG, for example, where the drug strategy is discussed, is even, okay, I will say directly worse, yeah? It's even worse. So there is not support, or consensus among EU member states on supporting this, not at all.
Okay.
Again, prohibition.
Yeah. Thank you. Yes. So this and then one and okay.
Just a quick mention, because regarding the question of Mart about if there is any drug checking project with legal problems, I'm now part of Kaikon Analytics, but I was part of Energy Control, and I remember one case and one time that police came into the festival, in the middle of the festival. They wanted to stop the drug checking service and all this stuff. Took 2 persons to the police station. At the end of the story, the case arrived to the judge. The judge was amazed about what the fuck have in front of me. Why do you take these people here? Even said that she was more concerned for the distribution of straws to sniff than the drug checking service. So it's an example about the same that he was mentioned and other projects. Judges are not interested in prosecuting, maybe some stupid cops, but not all cops. And in 25 years of energy control, only once happened.
But Nuria was not for drug checking, was for the banknotes, for the sniffing papers. So it was not for drug checking that it was for the sniffing
She was
papers.
amazed at the end because she was worried about the straws, but the report of the police was because we were checking drugs and handle and all this stuff. But it's something like a strange and unique and very exceptional case, and maybe it will be the same in the other drug checking projects if it happens someday. Hopefully not.
Okay, thank you. So 1, 2, and then the 3.
Thank you. My name is Alex Stevens from the UK. Thank you for your fascinating presentations. It's been said that one of the main values of drug checking services is to provide early warning of changes in the market. In the UK, we see very concerning signs of an effect of the opium ban in Afghanistan. We see decreases in the availability and purity of heroin. We see increases in nitazene deaths. I was wondering if people on the panel could say if you're seeing similar evidence in your drug checking services.
Guy, do you want to answer as English? Melis Wedinos, what we are seeing this?
Oh, I should take this one. Alex, you should come to the session this afternoon at 4 o'clock about drug trends, where I will take the data directly from the European services and Wedinos. I won't spoil it any further now, but certainly if anybody on the panel wants to respond directly about nitazenes in their country, go for
it. So I don't have enough information to talk about trends, but we have seen some nitazene, some samples containing nitazenes recently. But surprisingly, sometimes we also see like very pure heroin, or so I don't know about trends honestly, but we have seen both things.
1, 2, 3. Okay. So this is sort of anecdotal. There was a recent study, I think, in the Baltics, but you know, during syringe collection program, think there was a national monitoring initiative a couple of years ago that found no nitazines, but all the traditional suspects, and no heroin, maybe only in Klaipėda, which is kind of like the coastal region. We obtained, I think it was maybe 100 or a couple of hundred nitazine tests and handed it out to syringe exchange points. Nitazines were found, so it will be interesting to see the next national survey of syringe collection analysis and what that's like. Because these were obtained informally, it's not that we can publish this or anything or easily make this public, but at least that served as a warning sign for institutions through unofficial channels that, according to your data, this doesn't exist. We know it exists because we did the test.
Yes. So in general terms, in Europe, is mainly in Baltic countries, Lithuania. These places are more use of nitazines, but also before were used fentanyls. So the countries that already they were using this kind of synthetic opioids, they replaced to nitazines because it seems that they provoke more pleasure than fentanyls. So they are more close to heroin in terms of pleasure and in terms of breath depression to fentanyl, so they have both, and of course they are very challenging. So things that we are beginning to see in Barcelona, some psychonauts that are looking for these substances, they want to dose them good. So the challenge for drug checking services will be not only to detect them, also to be able to dose them, because some people like them, and this is a reality. And then as trend, in terms of adulterants, what we are seeing more is in the UK, but mainly mixed with benzodiazepines, not with heroin. So nitazines, we need to be prepared because they will not only enter as adulterants, they will enter as a drug that people would like to purchase. Also, the reality is that purity of heroin in general terms is very low, it's pretty low. We are talking about 10, 15%. So tolerance of people to heroin is decreasing, and things will happen in this sense, but we still don't know how. It's clear that we will not leave what is happening in the States and also in Canada, because of course we have other implementation of harm reduction, we have other perception of stigma, so several things that also are playing there. But it's still unknown how they will affect, but of course they will affect. This is my opinion, at least.
So I have a question for Mariam. I wondered if you had any insight about why it might be that there are 25,000 people using, for example, the opioid kits from the vending machines, but only about 600 people actually doing any testing. Why would it be that there is 100 times less people testing than consuming?
So in Georgia, there is a scarce of these drug checking services, but there is also another organization which I mentioned, Community Alliance Mandala, and they are doing these drug checking tests in the nightlife settings as well as in the drop-in centers. And during this project, we tried to recruit new people and also informed other peoples about the services, but we had really limited, limited tools and limited skills to inform other people about the services, and I think this is the main reason why we can't recruit more people and also spread more information among them.
And one other small question, with the buprenorphine result, for example, or the LSD result, I noticed that these compounds were not on the chart that you showed on the previous slide. And so I wondered if there is, this could be the reason why the service users are not able to report that they found buprenorphine in the sample, because actually they do not know what color to expect. Do you think this is a possibility, or is there a more extensive chart that is given to them?
Like this could be one reason. And also I think that we need more drug checking kits to expand to detect the other kind of drugs in the samples. And for example, in our case, we only had these fentanyl strips and also reagents. So maybe these are not enough resources to check and to know the exact results of the drug checking kits. So that could be one explanation. Why was this the result by the end?
Okay, and we have one addition from Georgia, also from the hall.
Hello, I'm Ada, working with the harm reduction organization, which Mariam also now mentioned. And I have just 2 comments for questions. First of all, since the implementation of vending machines, and I was also involved in that time, they are working usually with the people who inject drugs. And they had just this 6-month project, and maybe that's why they find it hard to attract young people who use drugs recreationally and not inject drugs. So we work with those young people with the harm reduction organization and in nightlife settings, festivals and nightclubs, and also drop-in center. We just have these strips and reagents and not advanced methods for now, unfortunately, because we also operate in gray area where it's not prohibited but not also allowed. And what I can say now is that each year we are conducting between 3,000 and 4,000 drug checking episodes. Yes. Thanks.
Thank you. Addition to your question from Linas, and then one more question from the floor.
Yeah, I didn't really mention this in the presentation, but there was a very big debate in the organization of, whether to hand out tests, which we did in the beginning, or whether to do tests. And I was a very big proponent of we should not hand out tests. Because I have a chemistry degree. I remember in undergrad chemistry courses, the mistakes people made with elementary chemical instructions. And when people try to do tests at home, it's very bad. The data is horribly unreliable. You need at least 4 tests for MDMA. Reusable tests are like €5. Well, the ampules are €5, so you need like 15 euros for home test. And if we really want to collect data, then it has to be standardized. And you can't even let people fill out the forms on their own for the surveys, because the data entry then becomes compromised. You have to actually fill out the forms for people. And we used to give out fentanyl tests as well during one point when there was a very big scandal and everyone was afraid. And everyone started getting positive fentanyl tests on meth, well, not on meth samples, but on cathinones and stimulants. Because stimulants are very known to give false positives on fentanyl strips if they are above 1 milligram per milliliter concentrations. It's very unreliable to give people tests because the data cannot be controlled. And I wonder also, because I saw in your slide you had a lot of stimulants and contamination with fentanyl. So it's unknowable whether that data is true or whether these are false positives. So yeah, the handing out tests, don't do it. Test yourself.
Thank you.
Hi, I have a few questions for Miriam and one for Rafael. I wonder how many vending machines did you place, and was it? I assume it was in Tbilisi, but was it outside Tbilisi also, or just there? And also the concerns about police coming to address and arrest people who want to test because they assume they have drugs, which is a right assumption. So did you notice any problem with the police, standing outside, hiding behind the plant, near the vending machines or something, or did you see any problems with that? And just the next question to Rafael, you said that there's no law prohibiting, having a small amount of. Is it for all substances or just cannabis?
So within this project, as I said, we had really limited resources, so we only implemented this intervention within the Tbilisi region. So also another reason why we did this way was that we only had these vending machines in the capital of Georgia. So when it comes to police, we always try to inform peers and other people who use drugs in a clear manner. So we try to inform them in a way to do not spread additional information about vending machines, to don't be some like police and other law enforcement persons suspected. And we also have really good communication with the harm reduction centers, and they are helping us. And also we have this improvement from the mayor of capital of Georgia. So this kind of communication and coordination with them help us to be really so yeah.
Okay.
And just to answer the second part, just to preface, I'm not a legal expert, so, but my understanding from having read the law is that what it says is that you can be fined for having substances in a public space, in via pública, but not in a private place, and this is for all drugs. So, yeah, but of course the question is, how do you get to a private place? How does the drug get there? So at some point it must be in a public space, but yeah.
Teleportation was not invented yet.
One of the things that we are doing, for example, is to dilute all the samples in methanol. So on our head office, we are preparing the samples in methanol, and then when we are traveling from the head office to the big laboratory, this is in liquid and methanol. So then if something happen, at this moment it's very difficult to show that these are substances to use, because they are diluted in methanol and the amount is not active. So also, and this is why the first picture of my presentation, these small pots, this is how in Spain we are traveling with several amounts of samples, because they are not active anymore.
Thank you.
Oh no, dissolve with methanol, I should not. You cannot.
Thank you. So let's have the last question, because we are running out of time, and then all the other questions I guess you can address informally during the rest of the conference. Please.
Thank you for this session. I'm from Hungary, and I'm part of Party 8 community. And so what I've noticed that there are not only governmental and political and law-wise difficulties with the implementation of Party 8 harm reduction, but like the party places many times they do not welcome us even to distribute water. At least their biggest problem is that we distribute water, and then they think that they were going to get a lower profit. And if it's basically a question to everyone, if you know any practices to talk to these owners of these places, and what strategies we could have to solve this very capitalistic problem of people's health and safety.
So I don't know, right? It's just something that came to my mind, but maybe you can, because they're talking about costs, like a specific amount that they're losing. So maybe you can somehow argue beforehand that you're actually giving them something that, like, there is an added value to your service, right? So you can say, look, more people are going to come here because they know that in this space there is such a service, so we're actually providing you with something. You can maybe come up with some number, like, oh, look, we estimate that, this, I don't know, like you can somehow try to show them that you're not just taking away from them, but you're actually giving them, and maybe this way you can.
Also, another thing that came in my mind, another example, for example, is in Spain we are working with the doctors who are attending to festivals, and they have some interesting data, and one of these is that when the festival is giving free water, the number of emergencies for them are reduced to 80%. So the hydration of people is very important for their well-being. And then is also, this is a cost, you can calculate the reduction of cost for emergencies. So maybe no, the festival is no losing money, but health or emergency departments or emergencies are not wasting this money. Do you know what I mean? To try to find the other part.
I don't know. Also, some collectives or harm reduction groups, what they try to do is like a harm reduction seal of approval or something like this, like for the nightclub, like, oh, this is a certified nightclub that promotes harm reduction or something like this. Maybe this is also something that can be looked into.
Okay, thank you so much. Let's give a round of applause for our wonderful speakers. Yes, and for yourselves as well. Thank you so much for joining us at this very interesting session. If someone is interested, there is a checking magazine on